Good afternoon. My name is Dr. Betsy Tilson, and I serve as the State Health Director and Chief Medical Officer for the North Carolina Department of Health and Human Services. With me is Director Mike Sprayberry, the Director of Emergency Management for North Carolina. I'll run down some of the updated numbers for you all. As of this morning, we have 636 cases of COVID-19 in 57 different counties across North Carolina. The average age is 41 for people that have confirmed lab results. We have 50 current hospitalizations, and unfortunately we've reported 2 deaths for people with COVID-19 infections. We've completed 15,399 tests across the state from labs that are reporting in negative tests. And a reminder, not all labs are reporting in their negative tests. However, all are reporting their positives. And we have more than 15,000 tests pending. We have more than 10,000 inpatient hospital beds in the state, and more than 5,000 of those beds are empty, so 50% are still empty. These numbers are based on 75% of our hospitals reporting. And this does not include the additional surge beds that we expect our hospitals to have. We are working on being able to share this information as well publicly as we're ensuring our data is being validated and reliable. We have more than 3,000 intensive care unit beds in the state, and 566 of them are empty, so 18% of them are empty. And again, this does not include the additional ICU beds we anticipate for surge, and is based on only 75% of hospitals reporting. Before I turn it over to Director Sprayberry, let's just take a moment to remind folks about social distancing, or really physical distancing. We want you to stay socially connected, but we want you to stay physically apart. So you can protect yourself, protect the people you love, and others in your community and our state who might be at high risk for serious complications from COVID-19 with physical distancing. That means working from home if you can. Stay at home as you can. Keep your children home from childcare if you can. And if you feel sick and with mild symptoms, stay at home. Make sure you're calling your doctor to talk about your symptoms, but stay at home. It's the safest place for you as well as for your community and our healthcare workers. And your actions matter. We need to work together so fewer people will get sick at the same time. Stay home, save lives. Now I'll turn it over to Director Sprayberry.
Thank you, Dr. Tilson. Good afternoon. My name's Mike Sprayberry. I'm the Director of the North Carolina Division of Emergency Management. Today is day 17 of the State Emergency Operations Center activation for the COVID-19 response. 48 counties have their local emergency operations centers activated. 95 counties and the eastern band of the Cherokee Indians have declared local states of emergency. We currently have over 2,500 resource requests for a range of needs statewide. Last night, the White House and FEMA approved Governor Cooper's request for a major disaster declaration for North Carolina for COVID-19. This will allow local governments and state government agencies to seek federal reimbursement for 75% of eligible costs in responding to the pandemic. Some federal assistance that North Carolina requested remains under review. That includes things like disaster unemployment assistance, crisis counseling, disaster case management, and additional assistance from the Small Business Administration. As the COVID-19 situation evolves and our state's needs change, these requests for assistance could be granted in the future. North Carolina 211 continues to help hundreds of people each day with assistance and information related to the coronavirus. By dialing 211, people can get help with food assistance, paying rent and utilities, and basic information. You can also receive information from 211 by text. Just text COVIDNC. Again, that's COVIDNC at 898-211, 898-211, to get regular information updates via text. Reentry questions continue to be significant here at the state EOC. I want to stress, in the event of a statewide stay-at-home order, businesses will not be required to have any credential to continue operations. Any such executive order and accompanying guidelines should be reviewed by businesses to determine whether or not they may continue operations. We have a strong team here at your State Emergency Operations Center that is working hard to keep North Carolinians safe. I have faith in the team. I tell them every day to have faith in each other and to call their loved ones and check on them. If we're all doing that at home and in our communities, looking out for each other, we'll get through this pandemic together and be okay on the other side. Thank you very much, and I'll turn it back over to Dr. Tilson. Thank you, ma'am.
Thank you, Director Sprayberry. And we're happy to take your questions now. Can't believe there's no questions, so I'm assuming we're having technical difficulty would be my assumption.
Testing. Can you hear me?
Yes, sir, we can.
All right, I'm through. Thank you for doing this. This is Joe Bruno from Channel 9. My question has to do with the tests. Do COVID-19 tests have to be sent to the lab right away in order for them to be accurate?
When you do a swab, what you want to do is have the swab and then you put it in what we call viral transport media. That's in order to keep that sample viable and usable. So you want to put it into that viral transport media right after you take that swab and then send it to the lab.
What's the timeline for that? If it sits on the shelf for a week, would that be problematic?
Oh, you asked the question, if you did a swab and then left that on the shelf for a week and then put in the viral media to send it to the lab, is that the question?
Even if it was in the media, if it took a week to be sent to the lab, would that be problematic?
I'll have to get back to you on the specifics of that. We could check with our lab personnel on exactly those parameters. So let's get back to you on the specifics of that.
Somebody go back to the room where they are, and let's find out, tell them that we can't hear any questions.
We apologize. We seem to be having some technical difficulties, and unfortunately, Director Sprayberry and I are not able to hear the questions at present. So we do apologize for this technical difficulty. As we're all trying to walk the walk of social distancing, we have to think through our the technical application of that. Okay, so we do apologize for the technical difficulty. We will work on improving this. And so for now, we'll end this for this afternoon, and we'll work to be better in terms of our technical our technical assistance of this. So thank you all, and be safe.